Hello, all. Welcome to the YouTube live session. We are super excited, as usual, to present with the third session of the YouTube live session. And today, what are the models that we are going to discuss today?
Well, hello everyone. Today we'll be looking into a few role play cards. So that will be the speaking module.
That sounds interesting. We request the viewers to wait for a few minutes. So we're expecting a few more candidates to join. So after a few minutes, we'll be starting.
Well, just let us give a buffer time of a minute and we will get right into the task.
Hello, all.
Well, welcome back to another session with Charkos Global.
So, as we have already told you, we will be discussing the speaking module today, and we can say it will be as interesting as writing.
Yes.
What do you say?
Yes, definitely, because today we are going to look into a few specifics of the module and what exactly and how exactly you have to start a conversation and continue the conversation, basically manage the task. Right, in those 20 minutes that a student gets, so how is it divided, and what exactly will an examiner or an evaluator be looking for? So these details and specifics will be discussed today. Hope you are with us throughout the session, and also please place your questions in the chat box so that we can see them and we will respond to them immediately.
Yes. I stress you can use the chat box to send us your queries which will be answered by us.
So, why Charkos when this question crops up? When this question crops up when every person's mind who is looking to migrate to different countries as a healthcare professional. Well, we would like to tell you that we provide international career opportunities and support you throughout your journey. We not only are into recruitment, but also let us tell you that we are into education, training, and we also provide pastoral care to nurses and the healthcare professionals on the whole. So there are multiple opportunities and positives by selecting Charkos.
And we can proudly say we are in the industry for the past 15 years, and the number goes on.
Yes, and we've been doing our best to bring to you, everything on your fingertips, and also to help you move ahead professionally.
So we help you in achieving your dream of working abroad.
Definitely. So, as we have already discussed before, we are just going to quickly skim through what OET is. So, OET is Occupational English Test, a language proficiency test basically for healthcare professionals. And this exam is for the healthcare professionals who seek to register and practice in English speaking countries. Right. And so basically, we have 12 different areas. And
yes, to name a few: dentistry, dietetics, pharmacy, physiotherapy, medicine, podiatry, nursing, radiography, occupational therapy, speech pathology, optometry, veterinary science.
Yes.
So when we look at the structure of the test, as we know that for any language for that matter, these are termed as the pillars of language. So you can say that I'm proficient in any language when we can read, listen, write, speak in that language. Put across in a simple words, it doesn't mean that you should be able to effectively communicate both in written and spoken language.
Yes.
So the OET exam will assess all four language skills, that is reading, listening, writing, and speaking. And one thing that should be kept in mind is each section is contextualized to reflect the real workplace scenarios in the healthcare industry.
Yes, and that's the advantage of opting for OET.
Yeah.
So OET is best suited for healthcare professionals, if you ask us.
Yes.
And
I think,
yes,
so
about the scoring and results.
yeah. You can please view the slide to know more details about the scoring and results. And before we say, like, it's very important to know the desired grading. So many countries would prefer a B grade in listening, reading, and speaking, and a C plus is accepted in writing.
It's accepted in writing, yes. So, as far as the recognition is concerned, OET is recognized by healthcare boards and councils, universities, hospitals in several countries. As you can see, we have named them here: Australia, New Zealand, the United Kingdom, Ukraine, Sri Lanka, Malta, Philippines, and to name a few, right? The OET exam is held 24 times a year. That would mean that it is held twice in a month, right? You have two slots, one for nursing and medicine and the other for all professions. And there are specific test centers around the world where the exam is conducted. The exam fee comes to approximately
32,206.
Yes.
Approximately.
Yes.
And the certificate is valid for 2 years.
So the benefits, what are the benefits? As we have stated, it is relevant. That is, it is specifically tailored to healthcare professionals, making it relevant and very practical for that matter. The validity would mean the scenarios and tasks that are reflective of real life situations. So if you're a doctor who is working there, who wants to go to the UK, for example, and how would you manage the scenario with with a native speaker who's the patient for you, or a nurse? The nurse can be from the intensive care unit, accident and emergency, pediatrics, skin care clinic, anything. So different scenarios, you're made to practice in different settings for that matter. And then you'll have to be empathetic towards the patient and how you respond to the patient, right? Professionally, yet sympathetically and with some empathy is what makes this exam a very valid one and a very, very practical one at that.
I think this is where their experience is going to help them out.
Definitely.
They would have definitely come across all these kinds of situations which they can be used in the relevant role plays, especially in role play case. I think it would be easier because they would have experienced.
Yes.
Come across all these things.
And you would have managed the situation. So it's the same thing. You're doing the same thing, but the person you're talking to, on the day of the exam will not look like a patient, but you'll have to imagine them to be your patient.
Yes. So, without waiting much,
yes,
I think our viewers also will be equally excited like us. So, without much wait, we will start a session. So, again, I think we'll welcome again.
Well, yes, definitely. Let's welcome them.
So,
again.
Welcome to OET Speaking, YouTube live classes conducted by Charkos Global. So these series of live classes will help you master the OET speaking subtest. So get ready to boost your communication skills and confidently ace your exam. So Dr. Anusha, shall we start?
Definitely, yes, let's start. So I'll be talking to you about the marking criteria. As you can see on the screen, the marking criteria will be based on your communication skills, grammar, pronunciation, vocabulary, and the like. So to give you an overview of how the speaking module works, basically you will be getting a role play card, right? Where the setting is stated and the background to the patient is given. Now, see, the thing is, we are going to be doing nurse-specific tasks for the day. And because we have n number of nurses asking us about the classes and about the scenarios. So we'll be concentrating on that for this session today. And so the background to the patient is given under the nurses, in the nurses block. And here you'll be understanding what the patient has been admitted for, or what the patient has come to you for. So these are a few things that you will understand.
So do you mean that that particular block would tell us about the patient, or would give us
Yes.
the patient?
Yes, it gives
details.
Yes.
So along with the current condition.
Yes, the current condition of the patient, and the reason you're going to be meeting them is what matters. And that you will understand in that block, which comes under the nurses block.
Can we just say that? So it would have been said that the patient name is this, and this year old, and this is the problem, this is the presenting complaint, is something like that?
Well, I would say that's actually a very good question, right? The name would usually not be given, but the age is definitely given sometimes. Most of the tasks have the age of the patient given, because you may be talking to either the patient or the patient's caregiver.
Right. So based on that, yes, probably the preparation would help us. Definitely. So, and of course, there will be setting. The setting might be definitely a hospital ward, sometimes an accident and emergency ward, community clinic. It might also be home visit.
Definitely. It will be a home visit. So, the way you're going to deal with these tasks is different, because you will have to introduce yourself in particular ways related to the specifics of the setting. All right, so you'll have to, there are different introductions. So we will be talking about that as well today. Well, moving on, as you can see, they say you will engage in realistic conversations with an examiner. In the bracket, if you can see, there is a highlighted word called interlocutor.
Yes.
So who is an interlocutor? The person whom you will be talking to on the day of the exam, right? That person is the interlocutor. They are not going to be marking you, but they'll be responsible for the recording, for the entire conversation that's going to get recorded. And they will ask you a few questions, check your student ID numbers and everything. And then you will have to do the conversation with them. The interesting part is you're a nurse, right? You're a nurse sitting there in front of them, and they will hand you a role play card. The interlocutor will play the role of a patient or the patient's caregiver. So that's why we say simulating real life healthcare interaction. So you're a nurse who will be interacting with a patient or the patient's caregiver. That's the role an interlocutor plays. So another question that some students do ask us would be, we have a role play card. So, do you also have a role play card? Is the question.
Even I have come across some such situations.
Yes.
Literally.
Yes. So,
and the answer is yes.
Yes, we do. But you should also know that it is not as elaborate as yours.
Yeah.
Your role play cards are quite elaborate with all the details given. But for us, we'll hardly have 2-3 tasks given. And that is done because we are there as a support. We are not the main characters, or rather, what can we say, the protagonist of the role play, the speaking module. You are. You are the whole and soul of the conversation. So how you manage the conversation, how you will gather information from the patient, that is the interlocutor, right? So all this matters.
And it is important to know that it is always you who will begin or initiate the conversation.
Correct. So
it is always the nurses,
yes,
to be expected to initiate the conversation with the examiner.
Right.
When we look at the marking criteria, definitely your assessment would be based on communication skills, grammar, pronunciation, vocabulary, and I think there are a few more slides next.
Yes,
a few more slides where we would in detail discuss about it.
Yes.
And the duration of the role play will go like this, where you'll be given a role play card and given 3 minutes for the preparation of the speaking task, and the actual execution of the task will be for 5 minutes. And as we have already told, it is always you as nurse who initiate the conversation, and you should be able to speak for 5 minutes.
Yes. So This division happens within the 20 minutes that is allotted for each candidate. So you're going to get two such role play cards. Okay, you'll get two role play cards, and for each role play card, you're going to get 3 minutes preparation time and 5 minutes time for executing the role play. So it is one after the other.
And before the actual speaking task starts, the first 4 minutes is quite reserved for the warm-up session. So what has happened in the warm-up session?
There, it is to make the student, the candidate feel comfortable. So don't get anxious that, oh, what will they be asking us today? Do I have to prepare for something? Well, there are a few basic questions that all of you can make a note of. A few. For example, can you tell us a little about yourself? So keep in mind that when you're answering these questions, you'll have to keep it very simple.
Yes.
We don't want elaborate answers. It is just to make you feel comfortable and to get started so that you don't get anxious and stressed about it, because no matter how much of preparation a student does, on the D day, it so happens that there will be, they'll have butterflies in their stomach.
Yes.
And they get a little jittery about it. So
yes.
Confidence is very important, guys. Confidence matters a lot.
Yes.
So
obviously, because you should never be nervous. And just imagine, if I can say that one thing that would help you, don't consider the examiner as an examiner, rather consider that the examiner will be your patient.
Exactly. So imagination plays an important role.
Yeah.
When you're sitting there, always imagine the interlocutor to be your patient. So look at them as a patient, and in that sense,
yes. And when you read that setting and the patient details, I think you have to visualize.
Yes.
So that's going to help you a lot. Okay, and coming back to warm-up questions, to add a few more things.
Yeah.
Would be definitely they might ask you, why did you choose nursing as your career? So please don't give one word answer also. Madam did spoke about it. Keep it simple. Keep it simple, but don't answer in a word.
Exactly, yes. That's
Right.
important. That's a very
I hope
good
you agree
point.
with that.
Yes, definitely. So please don't give one word answers. Let it be in a single, simple sentence. So, why did you choose nursing as a profession? And another question would be, what are the recent trends or developments in your profession?
It can also be about the challenges that are being faced in your profession, or they might ask you, why do you want to fly abroad?
Yes, and why OET? Specifically,
Yeah.
why OET, not
Yes.
IELTS or rather English language exams. So, why OET? Then you can always give your answer for that. But you know what? One tip that we would like to tell you is, though these are questions that will not be marked, it is important for you to note down your answers. So please make sure to note down your answers in a book. Just look at it now and then so that you don't forget what you want to say, and keep it as simple as possible. But as ma'am said, no one word answers, please.
Yes. And during the 3 minutes preparation, if you have any doubts, you are free to ask the interlocutor about it.
Definitely. You don't know the meaning of a particular word, then please make yourself free to ask. Other things that you can do during this preparation time would be to note down, simple points and probably prompts before you begin the task per se, and also maybe about a disease condition, or you want to ask the name of the patient and how they would want to be addressed during the conversation. You can also ask that, because there are, as we already told you when we began this module today, that you have different introductions, right? So the introduction will also depend on whether you're asking the patient, whether you've already asked the name of the patient during the preparation time, or you're yet to, ask the name of the patient. So there will be different ways of handling the scenario.
Yes.
So shall we move on to the next now?
Yes, please. So it talks about one of the important criteria. So the assessment would be done on the linguistic criteria and
and the clinical communication criteria.
Yes.
Okay.
So when we look at the linguistic criteria in particular, intelligibility, fluency, appropriateness of language, resources of grammar and expression plays a very, very vital, important role.
Yes.
I think we will look into these in particular in the next slides.
We will be telling you about all these pointers in detail. So see, as you can see on screen, we have written a little about intelligibility. So intelligibility is how the person sitting in front of you is able to understand what you're saying. The person should be able to understand what you're saying. And so for that,
you need to have a clear voice.
Exactly.
You have to pronounce your words correctly. And obviously, the tone plays a very important role because you have to keep in one thing in mind that the conversation is recorded and will be sent to other examiners for the evaluation. So, definitely, if something that is going to help you along with your confidence is your voice.
Yes.
So whether you are expressing your sympathy or empathy or your compassion, everything has to be done in the voice.
Yes.
So the tone, the modulation of the voice plays a very important role here.
Yes.
And it's equally important not to be
very fast or very slow. So you have to maintain a natural rhythm which is very moderate. So your speed has to be moderate. Maintain that speed. Not very fast, not very slow, and that natural rhythm while you're using these words. And your grammar has to be intact, as we were saying. So word stress, intonation, all these are important factors.
And the examiner should not be being strained to understand what you're saying. So, what does intelligibility say? That you have to speak fluently and in such a way that the examiner would understand what you trying to communicate.
Yes, so they should not be, straining themselves to listen to what you're saying. Probably keep the device closer to understand what you're saying, or all this affects the quality of conversation. If that happens, then it will definitely affect the quality of conversation. And please keep in mind that you need a B grade, right? You need a B grade that is 350 and above.
So this is where being simple, clear, concise,
yes,
plays an important role.
Moving on to the next one, fluency.
So what does it mean?
The smoothness of your speech.
So you should be able to speak continuously.
Yes.
Without any pauses. Nowhere you have to keep a pause for searching the words. And it is equally important not to use the fillers.
Yes.
Yeah, could you please give us some examples of fillers?
See, some people do have the tendency, like the one that I used just now was So this is what we call a filler. If you're using it throughout your conversation many times and you're pausing in between, then this gives a gap in the conversation and the clarity is lost. Clarity is lost, intelligibility is lost.
Yes.
So please don't pause for a long time to search for the right words. That's the reason we told you to make a note of the prompts before you start and during the 3 minutes preparation time. And so please don't use excessive fillers like, okay, all right, So these are fillers and don't use it excessively because these will affect your fluency and we don't want that to get affected.
Yes. And one more thing, we have to definitely tell our audiences about the repetition. The backtracking.
Backtracking, yes. Backtracking.
Because most of the students do that. It's like they tend to forget, or they might not be very confident, or they might be a little nervous. So, which ends up in repeating frequently the words.
Yes.
So, that has to be avoided.
And also, please make a note of this. Don't include sorry. Okay, just in the sense that you may have made a mistake while speaking. Don't say sorry and repeat the question or repeat the statement. This also affects fluency. That's what we mean, right? So backtracking is when you're doing this and also saying sorry for this. But there's a difference. You can actually say sorry when you're empathetic towards a patient's condition. You can surely say that, but not here.
Okay.
Moving on to the next one, we have appropriateness of language.
Yes. So although you are a medical professional, definitely you have to tailor your language in such a way that it suits your listener. So you might be an expert, but the opponent will not be. And you should also keep one thing in mind that as you know that the interlocutor might be very good at the language. So you have to equally match them. Keep it simple, concise, and the listener may not be from the same profession. So if you include a lot of jargons, so it might not be easily understood by the listener. So I think the candidates should keep this in mind.
Yes.
So the listener might not be aware of the medical terms.
Definitely.
So avoid using such things so that it takes on a smooth conversation.
Yes. And there are certain words that here I'd like to point out that there are certain words that you should not be using, because this is you're simulating a real life experience. We would personally like to tell you that if you say that the patient, when you're talking to a patient, you should not say something like, this disease is going to affect you, and that's why I want you to take up undergo the surgery or anything. When you use words like disease, it causes anxiety in a patient. So we would like to tell our listeners and the candidates to not use the term disease during the conversation. Instead, you can say your condition. So appropriateness of language is that. Say your condition will worsen if at all you miss out on a day's dialysis, something like that. We are just giving you an example. We'll get into the specifics soon, but this is what appropriateness of language refers to. Along with this, your tone of voice, that is, adopt the correct tone. Don't be really harsh when you're starting the conversation. Be empathetic towards the patient. Yes, and also it should not be a very casual tone or a very formal tone. It should be in between. And when delivering bad news, that would be if the patient's condition is worsening without a certain treatment, then how would you deliver it? Without affecting their affecting their confidence, probably the willpower to live. Yeah, so terminally ill patients or patients who are not able to recollect what is happening. So in all these situations, especially when delivering bad news, this can be either way. You may be giving the news to the patient or the patient's caregiver. So if it is to the patient's caregiver, please understand that you're not going to have such dark scenarios, extreme dark scenarios. No, you're not going to get such role play cards, but delivering bad news here would be a reference to giving them a hint regarding their condition, which may worsen.
Yes.
Moving on to the next one.
Of course, the grammar and expression, both are equally important.
Yeah.
As you say, as I've already said, that your content will be recorded and it will be shared for the further evaluation. So it is equally important to expression doesn't mean the facial expression here, but whatever expression is that you would be trying to express it in the voice. So the modulation comes in place here.
Yes.
So this is a test where your vocabulary and grammar would be tested. So it is important to have the language, use the language correctly. And it is very important to sometimes you tend to meet different kinds of patients. Some patients are quite smart enough to understand, as you say, but there would be some scenarios where the patient or the patient carer might not be able to understand.
Yes.
So in that, when they repetitively ask you, so you should be able to ensure a comprehension and make them understand.
Yes. So in such cases, you can actually repeat what you've said. So you can ask them, you can seek permission saying, would you want me to repeat the process?
Can I summarize it for you?
Yes.
Could I tell you again.
Yes.
I think it's very important for the candidates to add a few phrases in the middle of the conversation just to check in whether it is understood by the listener or the patient here.
Yes.
So they would do by saying it like, am I making sense?
Mhm.
Are you following me? Are you understanding? Am I addressing your concern? Is that clear? Am I clear so far? I think these are few examples.
These are few examples, and please sprinkle it like salt because these are tips. Okay, these do not complete the conversation. So, as ma'am is saying, you have to use it properly, maybe twice during the conversation, or whenever you feel the need to use it, please do.
And especially when you have so many things to communicate. So I think you can add up this phrase in the middle of that so that it doesn't sound monotonous.
Yes.
Because it's very, very important to include the listener also to be a part of the conversation.
Definitely.
It is not that only you give information and the opponent listens it silently. So you have to include the examiner or the patient or the patient carer, whosoever, to be the part of your conversation.
Yes. That's important. It should be a two-way conversation. It shouldn't be one-sided. If it gets one-sided, it gets lopsided. Next. Moving on to the next one, clinical communication criteria. So, till now, what you saw was the linguistic communication criteria. If you have any questions, please post it here in the chat box. We are waiting for your responses. And
yes,
let us know if you have a few questions here. You can post it, or probably what you think about us. Know if you want us to. Well, thank you, Isha. You've said that it is easy to understand. We are glad to be of some help. So, George here is asking us, Mom, when we receive the role play card, sorry, we are not able to see the. Could you please? Okay. When we receive the role play card, can we tear the card and write in the back side of the interlocutor's role? Role play card.
You will not be getting the interlocutor's role play card for sure.
You want. So if I'm right in understanding what Mr. George here is stating, I think, are you asking us whether you'll be getting, some space to write down the prompts? Well, yes, you will definitely get a small sheet of paper to note down your prompts. You don't have to worry about that, but please keep in mind that you're not going to be able to see the interlocutor's card.
Yes.
That for sure will not happen. You'll only be able to look at your nurse's card.
And during the preparation time, if you have anything to jot down, you can do that.
Yes. I hope we've answered your question, Mr. George. Is there any other question? Well, yes. There is there's a comment. Well, you see, we will be talking to you about the introduction and the conclusion. Not to worry, we will be telling you about that. So, introduction and conclusion with respect to a particular role play card. The general ones also we can tell you, but with reference to a particular role play card, that would be a specific setting, then yes, we will talk to you about that, and we'll also give you a a general note as well. You can note these down. Guys, please make sure that you're writing down all that we are telling you. There's nothing but lecture notes for the same, for the speaking module, and it will definitely help you out. It will surely help you out because today we are having a detailed discussion of this module, right?
Yes. I think we'll give them a few minutes to ask us a few questions. Or sure.
So, uh, can we just move on to the clinical communication criteria?
Yes, yes. I think again it's very very important. As we told, there are two criteria. One is the linguistic criteria where your language is assessed, and the clinical communication criteria through which like there are five different things that will be analyzed under this.
Yes.
The first thing is relationship building. How good you are in building the relationship, and patient's perspective.
Yes.
And structure, information gathering, information giving, which will be detailed discussing it in the next few slides.
Yes. So moving on to the next one. What is relationship building all about? So this is about introducing yourself or greeting the patient. That is to be friendly with the speaker and inquiring how they are doing today. This also depends on the setting. But nevertheless, you will be asking them. A general introduction can be something like, good morning. I'm Simran, one of the nurses in this unit. How may I help you today? Or maybe you can also say, well, if the patient's name is Julia, so you can go on to say, good morning, Julia. How are you doing today? So these are examples of how you can be friendly with a speaker.
If at all you have received the information where the patient is anxious, you can also start the conversation like, hello, Julia, you look anxious today. Yes. May I know what is concerning you?
Yes. So you are directly getting into the specifics of the card.
Yes.
And this again sets the tone to the role play.
And if it is a ward, they can also start by asking them, how are you feeling today?
Yes. Sure.
Good morning, John. How are you feeling today?
So this is a requirement being you are adopting the right tone, which is being respectful. Yeah, you have to be respectful towards the patient, and most importantly, non-judgmental. No matter what the situation is, you're not supposed to assume and judge. Okay, so being non-judgmental is very important. And
we have a question here by George. So George has asked, "Hello, ma'am. During the role play, if we still got time, we will repeat. Will we repeat the important points given in the card, or is it better to say other things related to the case that is not on the in the role play card?"
Oh, okay. Well, to answer this question, you can see about the timer. About the time, you can actually repeat a few things and then you can move on to say, so John, I'd just like to add that. So you will understand that there is not much time, but please don't stop the conversation before the interlocutor asks you to, because 5 minutes, you'll have to manage the task for 5 minutes effectively and efficiently.
So please don't stop conversing.
Yes.
Until you are informed that the time is up. So being empathetic is important with the speaker. So how can we do that? So you can say, I understand. It must be very difficult for you. If I were in your position, probably I would also have thought the same way. But please don't worry. We are here and we are here to help you.
So we will be looking at an example. We will also be performing
a role. Yes.
Yes, we will be playing the role of a patient and a nurse, and you'll get an idea about it in detail. Patient's perspective. So, what do we do, or how is this criteria assessed? So, you have to actively listen to what the patient is telling you. You should always be very alert, just like how you are with the other three modules. The same way, you have to be alert to what the patient is telling you so that you can relate to it and give your explanations, right? So, the other thing is, It is, yes, I think you got your answer here. It is good to do a repeat with the speaker so that, they have understood the conversation. And also, please make sure to pick up on the hints, hesitations, the change in volume. Probably the anxiety level in a patient might be quite high. So just make sure to understand it, okay? Recognize it and say, please don't worry, John. We are there. We are there to help you. Right? So this is what you'll be doing, and you'll be understanding the patient's perspective this way.
Well, then when we look at the structure, so normally it says it gives your role. So you would be expected to be in charge of the conversation throughout.
Yes, definitely.
And as we have already told, repetitions are sometimes necessary, and carefully. It is very important to carefully do your job. Okay, so you have to see that all the task prompts that is given has to be completed.
Yes.
So don't leave anything unattended. You should be able to speak about all the points that is given in the role play card.
Definitely.
Don't leave anything unattended. Sometimes there are scenarios where you will have only 3 or 4 prompts.
Yes.
So in that case, what would you do? Just tell us in the message that how would you handle such role play cards where you have only 3 or 4 tasks.
Sometimes 2 maybe.
Yeah.
How do you be handling less number of tasks in the role play card?
Use the chat box to know us your thoughts.
Well,
I think that is what George has asked us here. So if we still got some time, will we repeat the important points given in the card?
Yeah.
Or to speak about other things
Related to the case.
So he has already answered that question in advance.
Yes, we have. So moving on to the next one, information gathering. So what is about this information gathering? You will be asking a few questions to the patient in order to understand their condition better. And this task in itself may be given in the role play card. That may be given, or even if it is not given, please make it a point to ask them what is happening, to understand more about their condition, as I already said. So, not everyone, this point is interesting, not everyone will be forthcoming with you, because you may talk to an addict. You may talk to a patient who has some psychological problem. You may talk to a patient who has eating disorders or eating problems, right? So they will not be in a position to share with you what they are undergoing on a daily basis. So they will not tell you whether they are eating three meals a day, or whether they are eating well, or if at all they are eating well, what they are eating. So these are questions. And how many cigarettes a person smokes in a day, or the amount of alcohol a person drinks during the week. So these are such information is personal, and so it takes some time for you to convince them to talk to you. So that's why information gathering and the way you gather the information, how well you deal with it, tactfully deal with it, is important. So here we also say, ask you to use open questions to gather more information, and closed ones when you require just a yes or no to understand the level of understanding.
To add something to this, never ask 4 or 5 questions together. Keep
that's important.
One question at a time.
Definitely. So don't club questions. Don't put together everything. For example, if it is a question related to their lifestyle, we would not want you to ask, do you drink and smoke and also exercise? How many times do you exercise in a week? So there are 3 different topics to be spoken about. So take a chance to speak So as we've been telling you, the speaking module is where you can express yourself and show the person sitting in front of you how well you're able to speak the language and how well you're able to manage the content which is given to you. Right? So just make sure that you're asking them separately. You can instead say, so John, you told me that you've been smoking for the past 30 years. Could you please tell me how many cigarettes you smoke in a day? So I gave you a sentence that the patient had already told me. And I'm basing, the question that I'm asking you right now is based on that statement.
Yes.
So there's just one question. It might be a little long, but it is just one question that I've asked, right? So ask questions that are appropriate to the role play, and you sure will be doing that when you look at the prompts. You won't have to worry about that. The next one
is about information giving. See, it is equally important like information gathering. So you should give relevant information to the speaker. So, and check if the patient has or the speaker has understood everything that you have said. So this is what we told in the earlier slide.
Yes.
So it is very important. So how would you do that? You would definitely do that by asking them, am I making sense? Am I clear so far? Are you understanding my points? And then find out what the speaker already knows about the situation.
Yes.
And once it is given, it is very important to check if they have understood whatever you have tried to communicate.
And then you can move to the next topic. So that's about gathering information, giving information. Now about closing the conversation. Before we start this, right? I want you all to, type here in the chat box how you would usually close the conversation, or maybe your inputs. You can just let us know here in the chat box. So closing the conversation, how would we do that? So when the timer is up, you will have to end the conversation, right? So sometimes it's quite confusing. Okay, they asked me to stop the conversation. What do I say? So this usually that's a usual scenario with students, with candidates, but you can easily, if you don't remember anything, right, whatever you've prepared with, you can easily just end it with thank you. That's the easiest way of closing the conversation.
The second way is to please say and wish you a speedy recovery.
Yes, we wish you a speedy recovery. As you can see, I'll see you soon, or I'll see you soon, Wilson. So add the name. Why do we have to add the name during the role play card? While doing the speaking module, why do we have to insert their name now and then? Why do we have to say, well, Julia, we hope you're following this, or Julia, do you have any concerns that you want us to talk about? So why do we add the name? That that is like that's a very personal element, right? And that connects the nurse, the healthcare professional, to the patient.
Yes.
So the patient will be able to give you more information about their condition, what they feel. So that gives, it's sort of a healing factor also. And they feel happy when you're able to remember their name and also you're addressing them.
It's something sort of connecting with them.
Yes. And it's important because nurses.
And it's a normal tendency here, especially when areas saying that, thank you, ma'am, thank you, sir. So please don't do that. Instead, you would have definitely asked during a conversation how they might be willing to be addressed as. So please note down that name without forgetting. And then you have to address the speaker as definitely what they would like to be addressed as.
Yes.
So if they want them to be addressed as Miss Smith, and Miss Smith has to be the addressing element.
Yes. So whatever they ask you and however they tell you to address, you'll be doing that. So it would be Miss Smith if they want you to address them like that, or Mr. Smith, or maybe Julia, John, Kenneth, whatever it is. You will have to do the same thing. But please keep in mind that you can actually use your paper and your sheet. You can also look at the role play card. You can definitely do that. You have to do that, in fact. and look at the name that you have noted down and address them accordingly. So, for example, if the name is Mr. John Smith and they want you to address them as John, don't go on to say, John Smith, how are you? Don't say, Mr. Smith, how are you? Or don't say, Mr. John Smith, how are you? So, don't do these mistakes. Instead, be very alert, as we already stated in the beginning. Be very alert and please, address them the way they want to be addressed. So this is about the conversation. Closing the conversation. Um, we hope you're able to see the screen clearly. So we have one of our students, Mamta, and also we have Kimi, who have shared their experiences with us.
My name is Mamta Vinod. I'm one of the students of Charkos Institute. It's a privilege to be a part of this institute. I got Silver Ma'am as a mentor. She is a good, dedicated, and loving staff. She is a good motivator as well. She explains everything very clearly, and I'm very happy to have her. We have exams on Saturday in which we can know our outcomes. I'm very happy to be a part of this institute and I strongly recommend this institute. Thank you so much.
Hello everyone, my name is Kimi. Today I want to share about Charkos Global Academy that I have recently joined, and with the help of our mentor Simran ma'am, I have improved a lot, and I want to share everyone that if anyone is interested in writing OET and IELTS exam, I think it's the best academy for you to join as well. Thank you so much.
So here is the nurses cohort who have successfully joined in the UK, and also our team. This is by one of our students named Gloria. She has shared her experience with us, and here it is.
Hello everyone, my name is L'Oreal Ramsangli and I'm here to share my wonderful journey with Charkos. It has been a lifelong dream of mine to work in the UK, and finally that is going to be possible with the help of Charkos. So I first started my OET training under Charkos and I was able to pass in my very first attempt with the help of my skillful trainers, and I thought that the services were going to end there, but once you start under Charkos, they will help you until you reach to the UK. So they took the initiative of doing all my NMC registration. They booked my CBT, provided materials for CBT, and once I have finished my CBT, they further even scheduled different interviews for me. So with the help of them, I was able to secure a wonderful job at one of the most prestigious hospitals in the UK. So I really thank Charkos for all of their help. And as most of you may know, I'm still going to be facing an OSCE training in the UK, and I'm not scared to face that exam because Charkos will be providing me 1 week training at Mysore before I leave India. And once I reach the UK, they will be further providing me another training in the UK. So, with the help of Charkos, I am able to achieve all my dreams, and I highly recommend Charkos to all the nurses who are planning to work overseas. Thank you.
It's very nice to see the smiles on the face. It is the smile of success.
Yes, it is not just their success, but they've made us also a part of their journey, and
Yes.
that's an incredible feeling. Um,
Good evening, my name is Sarita. I am very thankful for this opportunity to share my experiences of Charkos Global. I am one of the OET student and I am very thankful for the great teacher Miss Simran who really sharp my memory and guide me where I needed the most. During my OET preparation, your dedication has really appreciated and I feel well confident to appear for my OET exam. Charkos has not only given me a confidence but provide me personal attention. Thank you for creating positive learning and thank you for being an essential part in my OET exam. Good evening, my name is Sarita. I am very thankful for
so this is one of our students as well. So what do you say? Shall we just look at one more testimonial and then get into the specifics of the role play card?
Yes, before that, we will have to highlight one thing that Charkos, as many of our students would have told by this time, it assists you in making your dream come reality,
Yes.
especially working abroad. Okay, and it is a free recruitment drive. So please keep that in mind. It's a free recruitment done by Charkos.
Hi, my name is Deepika, one of the OET student from Charkos Global. I'm going to appear my OET exam on 10th February. I wanted to take a moment to express my deepest gratitude for the incredible support and guidance from Charkos and my trainer, Ms. Simran, during my OET preparation. Your expertise and dedication have been invaluable, and I truly feel well prepared and confident for my upcoming exam. The comprehensive training and personalized attention I received at Charkos have not only boosted my confidence but also enhanced my skill effectively. I appreciate the positive learning environment you have created, and thank you for being an essential part in my OET journey. Hi.
So let's move on to now that we've seen a few testimonials. Shall we look into a role play card?
Yes, please. So, as you can see, so the role play card of the notes is being displayed on the screen.
Yes.
So, can we ask our viewers to prepare for that?
Yes, please. Please start. Please take a screenshot of this role play card, and also just prepare however you know, and whatever you're able to understand, and however you're able to understand it, no problem. Please do that and tell us how you would introduce yourself here for this setting of a suburban clinic. Please do take a screenshot of this role play card. We are telling you again so that it will be easier for you to prepare and prepare for the same, and you'll have the material right in front of you, because we are going to get into the details of this particular role play card. We'll also be giving you a sample conversation of the same. Let me read it for you. The setting is the suburban clinic. and the background is given. You see, this is the nurse's block where the background to the patient is given, and it says this parent is concerned about their child's forearm, which appears broken. The parent wants to know about the treatment and if the fracture will affect future growth. So, this is the background to the patient, and you will be talking to the parent, right?
Yes.
So, we are talking to the patient's caregiver. Please note it down. You'll now be talking to the patient's caregiver. This can be a prompt, and you'll have to ask questions accordingly. The next one, the tasks that you have. How many tasks do we have? Looking at the bullet points, we have 6 tasks.
Yes.
So the first one says,
find out how it happened.
Yes.
So how would you do that?
So you can actually also type in the chat box how you will be asking this question, find out how it happened. So frame a question for this as well, and you can type it here. So, well, thank you. Thank you for that. Find out how it happened. So you can say, well, can you tell me a little about how it happened? This is a simple question. The second task that we have is examination shows that the child has suffered a green stick fracture, which will require a plaster cast and a sling. Right? Verbalize. You'll have to explain it to the patient's caregiver.
And the third point says find out about the child's diet and suggest appropriate food intake to facilitate a speedy recovery.
Right. And the next one is about questioning about the future growth. So the patient or the parent may be asking you about the future growth of the arm. So explain that the future growth should not be affected. It will take approximately 6 weeks to heal. All normal activities are okay within limitations of wearing the plaster. So once you have stated this, then you're going to be explaining about plaster care. So you'll have to keep dry at all times, cover when showering or bathing
Periodically check the structure and integrity of the cast.
Yes.
And also the last task form stresses on importance of explaining about painkillers that will be prescribed, which is normally in syrup form.
Because this is a child that we are dealing with, the patient is a child, and so the medication or the medicines that you're providing would be in syrup form. This is the idea behind the role play card, and you are expected to start the conversation. But please keep in mind that you should not end the conversation. Manage the task for the full 5 minutes that you have. So we will now give you just a few, a few seconds to prepare for the role play card.
Yes.
Okay? And we'll also start with our sample conversation.
Yes.
You can always send us your comments here in the chat box so that we understand how you are trying to frame the conversation or how you would want to begin the conversation. Or probably, you know what you can do, guys? You can just take up one task from these 6 tasks and you can frame a sentence and share it in the chat box.
Yes.
We are waiting for your responses.
Well, I think why don't we actually do this task?
We will do this task. But you know what? We will not be setting the time for today because the audience, the students here should also know what ways, how they can start the conversation and everything. So we are not going to set the timer for today. What you guys can do is you can note down the conversation of both the patient and the nurse. All right, and you can use it for preparation. You can do that. And also, please keep in mind that this is limited to 5 minutes, right? But today we are not going to set the timer for ourselves. Instead, we are just going to talk and we're going to finish the conversation. We'll be covering all the points here and we'll be talking about it. So, this will help you understand how to go about a role play card, right? So, shall we start?
Yes, please. So, what role would you be playing?
I'll play the role of a nurse if that's all right.
Yes, I'll be the patient. Oh. So, in this case, it might be a patient care because it's all about the child's forearm.
So, being a nurse, you see, my pen is ready and I'll be noting down a few points. So, this is basically how it goes about. You're going to get 3 minutes time to prepare. Please keep in mind, once you get the role play card, the interlocutor will ask you, are you ready? I will be giving you 3 minutes time to prepare. So, the timer will be set for that. And in those 3 minutes, if you don't understand what it is, please make sure to ask them once. If they don't know, then it's fine. You don't have to worry. It need not be factual.
Yes.
It need not be completely factual, but please make sure that, see, it is a forearm that we are dealing with in this particular role play, and it's a green stick fracture. So make sure that it is related to the forearm and nothing else. All right, keeping these points in mind, you will have to prepare one task after the other. Okay, so you'll be doing that, and we will be following the sequence here in the card. So let us quickly again look at the task. We are supposed to ask how it happened. Examination shows the child has suffered a green stick fracture, which will require a plastic cast and sling, which is to be verbalized. Find out about the child's diet and suggest appropriate food intake to facilitate a speedy recovery. Explain that future growth should not be affected. It will take approximately 6 weeks to heal. All normal activities are all right within limitations of wearing a plaster. Explain
the plastic care, which where you should not forget about, or you have to talk about the keeping dry at all times, cover when showering or bathing, and periodically checking the structure and integrity of the cast. And the last task prompt says that you have to explain about painkillers that will be prescribed in syrup form.
Yes, done.
Are you excited?
I am. I am getting a little nervous, but I think this is the situation of every student, right?
Yes.
But I'm not going to let it affect me. I'll be confident.
All right. That's the confidence. Shall we start the conversation?
Sure. Can you just give me a second?
Sure.
All right. Shall we start the conversation?
Yes.
Are you all ready? Any questions? You can always post it here in the chat box. We'll get back to you right after having completed this role play card. Right. So, because I'm playing the role of a nurse,
and I'll be the patient carer.
And I'll be starting the conversation now. So this is the suburban clinic, and because it is a clinic and this is a walk-in, that is the patient or the patient's caregiver has come for the first time. As we understand from the scenario, my introduction is going to be a simple one, wherein I'll be asking the name of the patient or the person who is standing in front of me and ask them how I will be of help. How I can be of help to them. This is how I'm going to start.
Shall we?
Yes, please. So, good morning. I'm Anusha, one of the nurses in the suburban clinic. How may I help you today?
Good morning, nurse. I have come here with my son who has just hurt in the playground.
Oh, I'm so sorry about that. So, can you tell me a little about it? And before that, I'd like to ask you a few questions.
Please.
So, for documentation purposes, could you please tell me your name and your child's name, please?
Sure. My name is Melissa Smith, and my son is John Smith. He is 4 years old.
Oh, okay. And how may I address you?
You may call me Melissa.
All right, Melissa. So, Melissa, you told me that your child has hurt their forearm, right?
Yes.
So, well, can you tell me how it all happened?
Well, I just got a call from his nursery informing me that he had just fallen down from the equipment, playground equipment, most probably. Then I just rushed in and I could notice that my child had a swollen forearm.
Okay.
And I'm really concerned. Could you please find out if the arm is broken?
Well, definitely. We will definitely undertake an assessment and see what happens. We will also get an X-ray done. So yes, now all that is complete, Melissa, and the examination shows that John indeed has suffered a green stick fracture, and this fracture, to set it up, will require we have to use a plastic cast and sling.
Could you please elaborate a little more about the treatment required?
Well, yes, I'll surely tell you about that. But before that, let me tell you what green stick fracture is. I don't want you to be really concerned about anything because the green stick fracture is quite a common injury in children, in young children, and it is where there is it is not exactly a dislocation, but the bones are slightly away from their position. So this is a green stick fracture. It is not a major injury at all, minor injury, and that's why a plastic cast and sling is advisable for this injury. Okay.
All right.
All right. So I'd like to know a little about John's diet, if you don't mind, what he'd like to eat in a day.
Sure, I can tell you about it. Well, he loves to have non-vegetarian food. And you know the tendency of the kids.
Yes.
And he would love to have the junk foods as well.
All right. Okay. So I've noted it down. Non-vegetarian food and junk food. Well, Melissa, apart from this, does he like to have fruits or any other vegetables?
No, he says absolutely no for fruits and veggies.
Oh, okay. All right. So in that case, let me just give you a few suggestions if you don't mind.
Definitely, I don't mind. You may please proceed with it.
Okay. You see, I want you to include green leafy vegetables in his diet. Probably you can give it to him as soup, in the soup form, or make, a porridge out of it, or probably in salad form, or, something like that. Or you can add basil and other vegetables, or make it a veggie loaded and make a veggie loaded pizza. The reason behind this would be he requires a lot of nutrition right now.
All right.
So taking in a lot of nutrition will help speed up his recovery. Right. So it's very important for you to add spinach and other green leafy vegetables, which are high in minerals, and that will help him get better soon, because it is really tough to keep a child in one place with a plastic cast and sling, right?
Okay, I will definitely follow your suggestions, but please, I am very much concerned as a mother. I think you can understand that. Well, I am really concerned about his growth.
Okay.
I mean, I would like to know in particular whether his arm will grow properly in the future.
Well, yes, that's a very good question, actually. You see, the future growth of his forearm will not get affected at all. So you don't have to worry about it. But it'll take approximately 6 weeks to heal. And please make sure that you know, he has to wear the plaster at all times. You know, just see to it that it is there on his forearm at all times. You should not keep meddling with it. And all normal activities can be undertaken within the limitations of wearing the plaster.
All right, but I'm still concerned about the pain. He must be suffering with a lot of pain because he has never met with an accident like this.
Mm-hmm. Yes, I do understand that. It is a difficult phase for him. It will be for the first 2, 3 days, but don't worry, we will be prescribing painkillers, and this will also be in the syrup form. All right.
All right.
So you don't have to worry about that. But there is another thing that I'd like to tell you about. It is about the plaster care, how to take care of the plaster at home. So please make sure that it is dry at all times and covering while he's showering or bathing. And also do make sure to periodically check the structure and integrity of the plaster cast so that there's no, it has not loosened up or anything.
All right, I would definitely take care of such things. Thank you, Nose, for addressing all my concerns.
I hope we were able to help you in that. And if you have any concerns, you can always get back to us for a review. Thank you.
That's it.
Yes, that's it. It is a simple conversation. But just make sure that this is tailored to your time. Okay, time limit of 5 minutes, and you can use whatever we told you now. You can use it in your conversation. You can see that the conversation that we had just now is a very simple one, and try to manage it. It is only about managing the content that is there. And if you did observe, we followed the pattern given in the role play card.
Yes, and we would like to inform you that we will be continuing with the speaking module in the next week as well.
Yes.
So please stay tuned and subscribe our channels to know more updates about the classes.
Yes, about the classes and about training, recruitment. Any question that you have, you can always post it here in the chat box, and we are going to be there to answer all your queries. No problem at all. But do look forward to these live classes wherein you'll be getting to know more about each module in every session. Yes?
Yes.
Yes.
Well, I hope we were of some help for you today. And we are sure that it will be a great learning experience to you as well. With this hope, it is Nageshri S. Vivek signing off.
And this is Dr. Ranusha Bharat. See you in the next session next week at 2 p.m. Wednesday.
Yes.